Hello and welcome. So today we are going to look at hepatitis B and its serology. And so the hepatitis B viral infection is caused by the hepatitis B virus. It is transmitted sexually, parenterally, or vertically with an incubation period of about 1 to 6 months. Mostly, people remain asymptomatic, but sometimes may have mild inflammation of the liver, which resolves spontaneously within months. However, in some people, of about 1 to 5% of the population, there is persistence of the infection for about 6 months and over. And these are the group of people in whom we say have chronic hepatitis B infection. And this is usually associated with an increased risk of hepatocellular carcinoma and liver cirrhosis. Now, for descriptive purposes, the chronic hepatitis B infection has been grouped into phases. And so we have the immune tolerant phase, the immune active, the inactive carrier state, as well as the reactivation phase. Now, the details of this chronic hepatitis B infection is beyond the scope of this video. However, all that I need you to understand when we say immune tolerant is that, as the name implies, the body is now becoming tolerant to the infection. And so, in the immune tolerant phase, the hepatitis B virus is able to reproduce freely and quickly in the body without causing any damage to the liver. And so, after the person's immune system generates antibodies against the infection, the viral load as well as the ALT and AST levels begin to normalize. And this state usually may be short lived. However, in people who had hepatitis B infection from infancy, the period or the immune tolerant phase may last quite longer. In the immune active phase, as the name implies, this stage occurs when the person experiences an elevation or fluctuations in the ALT as well as the hepatitis B viral loads. And so these people have an active liver inflammation together with the presence of hepatitis B E antigen. And the hepatitis B E antigen, as we are going to see, is a marker of the level of infectivity of the patient, and it indicates acute infection of the infection. And so in the immune active state, they may also have, together with the liver inflammation, the presence of the hepatitis B E antigen positive in them, with elevation of the ALT, and also sometimes accompanied by fibrosis of the liver. After a while, when these patients, develop, or there is the introduction of the hepatitis B E antibody, we say they have seroconvert. And so this occurs during the infectious process of the disease. In the inactive carrier state, as the name implies, they are having the disease, they are carrying the infection, but it is inactive. And so the inactive carrier state is characterized by undetectable or low levels of the hepatitis B viruses, and it is associated with improvements in the liver inflammation as well as the fibrosis. And this phase may be lifelong, it may also even be decades, or sometimes it may be short lived. Finally, with the reactivation phase of the chronic hepatitis B infection, as the name implies, the disease became dormant, but now it is being reactivated. And so people who had hepatitis B E antigen negative may begin to experience reactivation of the virus, which occurs when the levels of ALT as well as the hepatitis B viral loads gets higher. And there is also associated with it moderate to severe inflammation of the liver. And so basically, this is all we need to know about the chronic hepatitis B infection. The details of it may be in a subsequent video. Now, it is important for us to also note that hepatitis C is the most common cause of liver cancer, even though we said that hepatitis B infection or chronic hepatitis B infection is associated with hepatocellular carcinoma. Now, in order to understand the serology of hepatitis B infection, there are some important markers which we need to familiarize ourselves with. And these markers are found on the structure of the hepatitis B virus. And so we have the antigens and the antibodies. The antigens being the disease-causing agents, and the antibodies, which are the disease-fighting agents. And so the first marker is the hepatitis B S antigen. S stands for surface. So hepatitis B surface antigen is found on the surface of the virus. Then we have the hepatitis B E antigen, which is the extracellular form of the core proteins. Then we have the innermost being the hepatitis B core antigen, which is found within the core of the virus. An important thing we need to know is that the hepatitis B core antigen cannot be seen in peripheral blood. Just as we have the antigens, we also have the antibodies which fight against each of these antigens. And so we have the hepatitis B surface antibody which targets the hepatitis B surface antigen. We have the hepatitis B E antibody which also fights against the hepatitis B E antigen. Then we have the hepatitis B core antibody which comes to fight against the hepatitis B core antigen. We are going to pick each of them and explain what they do. And so the first one we are going to look at is the hepatitis B surface antigen. And as we said, the hepatitis B surface antigen is the outermost part of the virus, and this appears first during the incubation period of between 1 and 6 months, averagely between 2 to 7 weeks prior to the appearance of the symptoms, and it peaks when the patient is acutely ill. Now, anytime we find the hepatitis B surface antigen in the blood, it indicates active infection of hepatitis B, which may either be a recent or chronic infection, or the patient might have been vaccinated. Now, it is important for us to note this because the vaccine which we use in immunization for hepatitis B was manufactured, or it uses the inactive form of the hepatitis B virus in the preparation of the vaccine. And so periods shortly after the vaccination of an individual for hepatitis B infection, the person may test hepatitis B positive. However, this may not cause infection in the person. The essence of this is that it will allow the body to mount an immune response against the inactive form of the disease, such that in the near future, when the person develops or gets the hepatitis B infection, because the body has already mounted an immune response, it will attack the current virus and destroy it. And so the person may not get the infection. And so anytime you find hepatitis B surface antigen in the blood, you may have to do further investigations to know whether it is a real infection or it is from vaccination. The second one we are going to look at is the hepatitis B E antigen. Now, the E antigen, shortly after the person has developed the hepatitis B surface antigen, appears together with the hepatitis B viral DNA. And so we are able to detect it after you have developed the surface antigen. And anytime we find the hepatitis B E antigen in the blood, it serves as a marker of replication, that the virus is replicating more. It also tells us the level of infectivity, how infectious the patient is, and also indicates that the person is having an acute infection with hepatitis B. Now, the next one we have to look at is the hepatitis B surface antibody. The hepatitis B surface antibody appears once the acute disease has resolved, and sometimes it may not be detectable until weeks or months after the hepatitis B surface antigen has disappeared. Now, this short period that we are unable to detect the hepatitis B surface antigen together with the hepatitis B surface antibody is what we refer to as the window period. Now, anytime we find the hepatitis B surface antibody in the blood, it indicates immunity. So the patient might have been immune through vaccination or after the patient got infected. So this is the period when we get hepatitis B surface antibody in the blood. The next one is hepatitis B core antibody. And hepatitis B core antibody is the first detectable antibody during the infectious process. Now, this hepatitis B core antibody may also have the hepatitis B core antibody immunoglobulin M. And the immunoglobulin M is the only marker which is detectable during the window period. That's when we are unable to detect both the hepatitis B surface antigen and the hepatitis B surface antibody. Now, once we have the hepatitis B core antibody immunoglobulin M, it indicates that you are having an acute infection. And so, after a few months, the immunoglobulin M to hepatitis B core antibody is replaced by the IgG component of the immunoglobulin. And so anytime you have hepatitis B core antibody of immunoglobulin M, it indicates that you have a recent or an acute infection. And anytime you have hepatitis B core antibody to immunoglobulin G, it means you have a chronic infection, a previous infection, or an ongoing infection. And so once the immunoglobulin G to hepatitis B core antibody presents in the blood, it persists for life. And so it serves as an antibody that protects you from the infection. Now, the next one we are going to look at is the hepatitis B-E antibody. And the hepatitis B-E antibody only indicates that there is subsiding of the viral activity in the blood. Now, anytime we have loss of the hepatitis B-E antigen and the appearance of the hepatitis B-E antibody in the blood, we say this is a period of what? Seroconversion. Now, once we have hepatitis B-E antibody in the blood, it indicates or it serves as a predictor of low infectivity. It also tells us that the viral DNA has reduced levels, and we also use the levels of the hepatitis B-E antibody in the blood to monitor the response to treatment. And so anytime we have the hepatitis B-E antibody in the blood, it tells us that whatever treatment we are giving is working. And so the person is no longer in a state of infecting other people with the infection, or does not have any active or any infectious process going on in the body. Now, once we are done with this, how then must we test for the hepatitis B virus? First of all, what we need to do is to screen for the hepatitis B core antibody. We screen for the hepatitis B core antibody because it's going to tell us whether you have an ongoing infection, whether it is a recent or a chronic infection. This is what it tells us. Then you look for the hepatitis B surface antigen. And the hepatitis B surface antigen is going to tell us whether you have an active infection going. If the two are positive or if they are reactive, then you do the profile by looking for the hepatitis B E antigen. And as we said, the E antigen is going to tell us the level of infectivity of the patient, as well as the hepatitis B core immunoglobulin M. This will give us information as to whether you are having an acute infection or a chronic infection. And the hepatitis B viral DNA is something we need to request for to know the levels of the virus in the blood, which we call the viral load. And so we say together, all these tests will show whether the patient has an acute or chronic infection, whether the patient is immune due to vaccination or past infection, or whether the person is having a chronic active or inactive infection. Now that we've seen this, we are going to look at a series of examples with patients who present with some serology in order to understand how to interpret them when we find one. So the first one we are going to look at is a patient who presents with hepatitis B surface antigen negative, core antibody negative, and also surface antibody negative. So what this means is that once the hepatitis B surface antigen is negative, it means this patient has no active infectious process going on. Once the hepatitis B core antibody is also negative, it tells you that this patient has never had any past infection or is not having any ongoing infection. And the patient is also having a negative hepatitis B surface antibody, which tells us that the patient is not immune in any way. The patient is not protected in any way. And so this patient, we can say, is not infected with hepatitis B, but is susceptible to hepatitis B infection. And so these are the patients who we advise or encourage to go and take the hepatitis B vaccination. The second patient presented with hepatitis B surface antigen negative, core antibody reactive or positive, and the core antibody to immunoglobulin G also positive or reactive, and the hepatitis B surface antibody reactive, and the E antibody also reactive. And so basically, just like we've done, once the S antigen is negative, it tells us that the patient has no active infection going on. The core antibody is reactive, and so it tells us that at a point in time, this patient had an ongoing infection or had a past infection. And the core antibody to immunoglobulin G is reactive. And we said once you have immunoglobulin G, it tells us that you have a chronic infection or a past infection. Then, once the patient is having surface antibody reactive, it tells us that this patient is protected or this patient is immune. And the patient is also having hepatitis B E antibody reactive. What it tells us is that the B E antibody came to fight against the hepatitis B E antigen. And so this patient had a past infection and has now either recovered and has developed immunity. And so this patient is having very low infectivity. And so this patient, we say, is having what? Immune to hepatitis B infection due to the natural infectious process. The next patient presented with hepatitis B surface antigen reactive, core antibody reactive, hepatitis B surface antibody negative, and core antibody to immunoglobulin M reactive. So this is straightforward. Once the hepatitis B surface antigen is reactive, it tells us that there's an active infection going on. The hepatitis B core antibody is also reactive, so it tells us that the patient might have had a past infection or is having an ongoing infection. But the patient is not having any hepatitis B surface antibody, and so the patient is not immune. Yet the patient is having hepatitis B core antibody to immunoglobulin M. So what it means is that the patient is having an acute infection. Remember, we said immunoglobulin M is a marker of acute or recent infection. And so this patient, we can say, is having acute hepatitis B infection. Now, with the subsequent ones, I want you to pause it and try your hands at it before we explain. And so in the next patient, he presents with hepatitis B surface antigen negative, hepatitis B core antibody negative, and hepatitis B surface antibody positive. Now, once the hepatitis B surface antigen is negative, it tells us that this patient is not having any active infectious process going on. The patient also does not have any hepatitis B core antibody, and so the patient is not having any past infection or an ongoing infection. However, this patient is having hepatitis B surface antibody positive or reactive. What it tells us is that this patient is immune. But how is the patient immune if the patient is not having or has never had the hepatitis B surface antigen before? So this is where you need to take your time to explain to the patient that he is rather having the immunity or the hepatitis B surface antibody due to the vaccination that he might have had in the past. And so we say this patient is immune due to immunization. The next patient, we have the patient presenting hepatitis B surface antigen positive, core antibody positive, core antibody to immunoglobulin M negative, but hepatitis B surface antibody is also negative. And so this patient, once the surface antigen is positive, we say the person is having an active infection. Also, the patient is having the core antibody positive. So it tells us that the patient is having an ongoing infection or a past infection. But if you look at the immunoglobulin M to the hepatitis B core antibody, it is negative. So once the immunoglobulin M is negative, it tells us that the patient is not having an acute infection, but rather a chronic infection. And if you see the hepatitis B surface antibody, it is negative. And so this patient has not developed any immunity, however, is having a chronic infection. And so this patient, we say, is having a chronic hepatitis B infection. The next one, you may pause it and try it by yourself. This patient presents with hepatitis B surface antigen positive, hepatitis B core antibody positive or reactive, and hepatitis B E antigen also reactive, as well as hepatitis B core antibody reactive. However, the patient does not have hepatitis B surface antibody. And so once the surface antigen is positive or reactive, you say the person is having an active infectious process going on. And once the core antibody is also reactive, we say the person might have had a previous infection or an ongoing infection. And once the E antigen is reactive, it tells you that the patient is having an active or acute infection. And so the person is highly infectious. We said E antigen represents the level of infectivity and also how the patient is replicating. And so once you have the hepatitis B E antigen reactive, it tells you that the patient is highly infectious and is able to spread the infection to other people. The patient also has hepatitis B core antibody to immunoglobulin G reactive. And so we said once you have immunoglobulin G reactive, it means you are having a chronic infection. And we can also see that the patient has not developed any antibodies to the hepatitis B surface antigen. And so we say the person is not immune. And so basically, this patient is having a chronic active infection. Chronic active because we have hepatitis B core antibody to immunoglobulin G active or reactive, and the patient is having hepatitis B E antigen also reactive. So this patient is having an active infection together with the persistence of hepatitis B surface antigen. So we say this patient is having a chronic active infection. Then we have another patient who presents with hepatitis B surface antigen reactive, hepatitis B surface antibody non-reactive or negative, but the patient is having hepatitis B core antibody to immunoglobulin M positive or reactive, as well as hepatitis B E antigen reactive. So what does this tell us? This tells us that once the hepatitis B surface antigen is reactive, the patient is having an active infectious process going on. And once the patient does not have hepatitis B surface antibody present, we say the person is not immune. However, the person is having hepatitis B core antibody to immunoglobulin M positive. And so we say this person is having an acute infection because we said immunoglobulin M is a marker of acute infection. The person is also having hepatitis B E antigen positive. We said once the E antigen is positive, it means you are highly infectious. And so this patient, we can say, is having what? Acute infection. Acute infection because the patient is having the surface antigen still persistent. The patient is having the immunoglobulin M also persistent, as well as the E antigen also persistent. So this is an acute infection. The patient is highly infectious. Now, we have another patient who presents with hepatitis B surface antigen reactive, hepatitis B surface antibody negative, and hepatitis B core antibody to immunoglobulin M negative. But then we have hepatitis B core antibody to immunoglobulin G reactive, and also the patient is having hepatitis B E antibody reactive. What this tells us is that the hepatitis B surface antigen is reactive, and so there's an active infection ongoing. But the hepatitis B surface antibody is negative, and so this patient is not immune. But the patient is also not having hepatitis B core antibody to the immunoglobulin M, but rather is having the antibody or the immunoglobulin IgG reactive. And so once the IgM is negative, it means there is no acute infection, but the IgG is reactive. And so we say there is a chronic infection, and the patient is having hepatitis B E antibody reactive. What it means is that the E antibody has come to kick against the hepatitis B E antigen. And so this patient is having low infectivity. And so in summary, we say this patient is having a chronic inactive infection. Chronic because the person is having hepatitis B core antibody to immunoglobulin G reactive. Inactive because the hepatitis B E antigen has disappeared with the presence of the hepatitis B E antibody. And so this patient is not having an active, or the patient is not acutely infected, though the hepatitis B surface antigen still persists. And so this patient is having a chronic inactive infection. Now, once we have seen these examples, another important thing that we need to know is the hepatitis B viral DNA. And as part of the serology, it is important that we request for the viral DNA to know the viral loads. And so the hepatitis B viral DNA helps us to assess whether the patient is recovering from an ongoing infection. Because if the person is recovering, the viral load will reduce. Also, it tells us whether the patient is a candidate for the initiation of the antiviral therapy. The hepatitis B viral DNA also tells us or gives us information to differentiate between the inactive carrier state as well as the chronic active infectious state. And so once we have this information, we are able to determine when to start treatment. And so the cutoff for the initiation of antiviral therapy, we have it in a chronic hepatitis B patient with hepatitis B E antigen positive. So anytime you have such a patient with a viral load of about 100,000 copies or 20,000 international units, you may initiate the antiviral therapy. Or if you have a patient who has chronic hepatitis B infection with hepatitis B E antigen negative, however, having viral loads of 10,000 copies per ml or 2,000 international units per ml. In these patients, you may initiate the antiviral therapy. Now, the last thing I want to say over here is that it is important for us to note that treatment of hepatitis B infection is based not only on the levels of the hepatitis B viral DNA, but also on the levels of the liver enzymes ALT. And so we must put all of them together in order to help us diagnose and also help us to initiate the treatment of hepatitis B infection. And so together with the serology, we must request for hepatitis B viral DNA as well as the liver enzymes to help us in the management of our patients. Thank you very much for your time. Bye-bye.